Can I show you another one?
Please,
that we would look? So again, coming onto all fours. And the other thing to point out is that going back to some of the extension comments before, is some patients, you've got really good sort of abdominal control, some patients would really let this belly sag, particularly people that maybe haven't done exercise for a long time. And part of the work is just to get them to engage the abdominal muscles here, not gripping or any sense of tightness, but just to learn actually how to stop this sometimes hyperextension and that facet irritation happening. So by engaging here and then doing the circles, we would also work on that. And then I would ask them, and this is where yoga really brings breathing into the movement. You would breathe in here, and then as you breathe out, you take your bottom back to your heels. And again, let's imagine that you've got chronic pain. That might be enough today. And then you'd inhale and you'd come forward. And exhale and go back. And you're going to be starting to notice, if you haven't moved much, so you can carry on, you'd start to notice, some people would start to notice the QL picking up right here, and they'd be worried about a spasm. So I'd say, okay, stay there. Breathe, a couple of breaths. Breathe in, breathe out. Is it okay? And then we might try and move back another ½ centimetre. And then we'd say, okay, come back.
Yeah.
So breathing in on all fours, and then breathing out, taking the bottom back towards the heels. So you're just starting here to get a little opening of the structures in the spine. We've got the spine there, but we don't need to look. I think we can all picture what's happening. And just again, that reassurance that actually it's safe. The body is a safe place.
And again, how many of these?
I would again say, start with 5, see how it goes. Breathe deeply, see where the movement takes you, and you can come up. The thing with chronic pain patients, thank you, is that some days are always going to be better than others. I think a lot of our patients come expecting that the road back to health and no pain is going to be a straight line, and actually it rarely is. If we think of our own, recovery, it's quite often wavy, and so some days might be worse. And so actually just to not be scared of those days when they happen, and actually maybe you can only move this much on one of those days, but tomorrow you might be able to move that much. So it's a slow process.